So hospice care in veterinary medicine is an opportunity for us to provide the best care possible for our patients at the end of their life. It does draw a lot of parallels with human hospice, and human hospice began around the 1960s and really built momentum from there with the idea that life is precious, that we can provide enriching life for a dying patient and also provide support, emotional support, spiritual support for any caregivers that are caring for their loved one through the dying process and beyond. So it's an opportunity to take something that we haven't necessarily focused a lot of time and energy on in veterinary medicine, which is death, and say, you know what, this is a very important part of our field that deserves our attention. And we also can say to our dying pet patient and to their family that this animal is important, that their life does matter. And we do want to make sure that they are provided, good palliative medicine, that all of their physical needs are met, that they're not experiencing pain any more than necessary, and any of the symptoms that come along with disease that would affect a dying animal. So we provide emotional and physical support for the pet, and we provide emotional support for the caregiver. So in human hospice, one of the central tenets is that the patient is not just the person who's dying, but for all those that love them and want to have a meaningful experience for them. And so in veterinary medicine, our patient is the pet and the family. That is a central tenet of veterinary medicine and within hospice. So fortunately, there's been a lot of trailblazers out there doing the work to bring hospice into veterinary medicine, and that started around the 1980s. There were a few veterinarians that were identifying what's happening in the human medicine side of things and saying, you know what, we can apply this in vet med. And so they started to, again, blaze the trail for the rest of us that started to pop up here in this century. So right around 2000, there was a lot more books being written, a lot more articles. There started to be associations that were being developed to support all members of the veterinary team that could provide this care for the pet and for the caregiver. And fortunately here in the last, I would say even 5 to 6 years, since about 2013 or so, there's been even a bigger, broader leap forward with now more books being written, and the International Association for Animal Hospice and Palliative Care created a certification program for veterinarians and for technicians, really showing the veterinary profession that it's not just hospice, it's a medical model of care that is really deserves a lot of attention and focus and training to be able to provide the best care possible.